of the foremost experts in special education, lifelong learning in Ireland, or indeed in many other countries as well, Michael Shevlin, will be presenting the results of the project. Now, Michael is well known to all of you. He's Professor of Inclusive Education at Trinity College Dublin, and he's the Director of the Trinity Centre for People with Intellectual Disabilities. Michael's part of this research team on reviewing educational provision for adults with disabilities in day services. He has a very distinguished track record in not only researching but supporting people with disabilities, and he has published numerous books and papers, both nationally and internationally, in the field of special and inclusive education. So it's my great pleasure to invite Michael to make his presentation. Thank you. For this, I'm not sure.
Green. Thanks very much, Sheila, and it's my pleasure to be here this morning, and it was my pleasure to hear Professor Sheila Riddell, who I think provided a thought-provoking and very much engaging context for us to consider all these different issues in. As Sheila Drudy said there, Rosalind, one of our co-authors in this research, is unfortunately unable to attend due to illness. So what we want to look at is, well, I hope you were saying green. Top one. All right, okay. There we are. There's still learning to be done, isn't that right? So the first thing really is to look at what was the rationale for this review. And I think as Sheila Drudy said earlier, under the EPSIN Act, the NCSE has a role to review the provision made for adults with disabilities to avail of higher adult and continuing education, rehabilitation and training, and to advise educational institutions on what is happening in this area. So basically, what the aim of the review was to develop an understanding of the educational and learning provision in adult day services. Those adults with disabilities who have left school and are accessing day services. So we're going to be looking at the range and scope of provision, how it is delivered, and what outcomes are achieved. And one of our tasks as well is to develop a framework to provide a structured approach to actually examine and look at and review the provision. So in the terms of the scope of the review, when we ask who is involved, it's adults with a variety of disabilities. It's also adults who've experienced life-changing illnesses such as heart attack or stroke. The location, again, is adult day services, and their aim is to help people with a disability to make choices and plans to support their personal goals and to achieve those and their aspirations, and to be active, independent members of their community and of society. Now, in terms of what, again, Professor Sheila Riddell was talking about, the whole area of lifelong learning, and within that we're considering formal, non-formal or informal learning, which aims to improve knowledge, skills and competence for people with disabilities in day services. So this is the approach that we've been taking, and we're just at a fairly early stage of the research. And obviously we have the desk-based research looking at the literature, and as will become evident, there isn't an enormous amount of literature within this area, nationally or internationally. We're looking at a survey of adult day services, and we'll tell you a little bit more about that later, where we are in relation to that. And we'll talk a little bit about the stakeholder consultation with policymakers in the disability and education sector, and we have a little more to say about that because that's almost complete. And finally then, and probably most importantly, there will be site visits to adult day service locations. So we'll just take you through what we've done and what we've found so far. We can see that we have 5 papers developed on the profile of what's the educational learning provision, We'll be looking, again, we've looked at the context, so what is the policy legislative environment? Obviously the literature review, and then trying to develop a draft framework to review education, and then looking at definitions. And again, this is obviously an area that requires careful attention. So what were some of the issues arising from the literature review? I think all of us are very aware that there's been a real transformational change in policy and service provision, which impacts on the lives of people with disabilities. And within the broader educational framework and within society, there's been a very definite shift from a medicalized approach to a social model, and with the emphasis again, as you heard in the first talk, around autonomy and independent living. And there's increased focus on a life course approach within all these different types of service models that are being developed. However, many developments nationally and internationally have not been fully documented. And so there is a paucity and a shortage of in-depth research studies detailing developments in service provision. And also part of the reason for this is that in other countries, they don't necessarily have the model of day service provision that is prevalent in Ireland. And linked to this is there's been very limited critiques of the effectiveness of the reformed service provision on the lives of people with disabilities. So we don't have a complete picture of what the impact has been for people with disabilities of these changes. And again, trying to look at what's happening within the whole lifelong learning space within adult day services has not been really documented. So it's very obvious that international and national policies are very much advocating and legislating for inclusive environments. And the whole aim of this is to promote greater participation of people with disabilities within society. However, it's very evident as well when we look across the research domains and the research studies that developing more inclusive provision has not been uniform, and there are significant variations both within and between countries. So establishing appropriate individualized services within a community setting, enabling independent living, and fostering access to high quality care and support services has proved challenging. And we'll see a little more about this later when we look at the stakeholder consultation. So this is the draft framework, and this was the structure to try and collect evidence in a kind of structured, coherent manner. And we can see that the first element of this is the person-centered approach to lifelong learning. And we'll be, again, within that, looking at the person-centered planning, the individual plans, about how these are connected then to lifelong learning goals for people with disabilities. And we'll also be looking at what contribution do people with disabilities within the day services make to these plans and these decisions. The second pillar then is looking at outcomes and looking at what is the impact on participants of involvement in lifelong learning opportunities, and what is the value to these people in their lives, and does it contribute to greater independence and greater autonomy. The third area then is staff capacity to deliver lifelong learning provision. And so looking there at appropriate training, what is the training of staff within adult day services to enhance their knowledge and skills to develop lifelong learning and deliver this? And what are effective learning techniques, looking at the practice and what has happened within that? And finally then, the organizational culture. So what is the vision of the organization? What type of service culture? Is this inclusive? Is there a holistic approach? And then just a brief overview of governance and management, and then also looking at staff attitudes to learning and lifelong learning. So that's kind of the draft framework. So the first part that we've been involved in really developing and looking at is the stakeholder consultation piece. And so this consisted of 20 interviews with policymakers, disability representative organizations, and educational providers. And of course, the idea behind this is that this will inform other strands of the study and help us to refine the draft framework and to make it as coherent as possible. Just to emphasize again, these were very open-ended discussions and consultations, and these consultations are very much the perceptions of stakeholders. And we're not obviously attributing these perceptions to any one group, but we're trying to give you a flavor of what people were saying and what their opinions were. One of the first things that came through very, very strongly was the complexity of the policy context in which adult day service provision is offered. And we saw that this was compounded by the legislative context, where there's no legal basis for education provision post-18 for young adults with disabilities. There was also a perception that there was a lack of joined-up approach to serving the needs of adults with disabilities. There was often inequality when compared to those without disabilities. So people with disabilities do not get access to the same opportunities or services, and this was a very widespread perception. There was also a perception that there was inadequate funding of services, and that this led to many difficulties in fulfilling individual plans and addressing the needs of people with disabilities in the services. Further, in the stakeholder consultation, what was very evident was that service provision for adults has been undergoing significant change. There's been a move from a clinical approach where supports were often medicalized or viewed primarily through a health lens to a more individualized social model. And of course, within this transition, there are obviously significant challenges. So the New Directions report led to an overhaul of how services are provided, and this is obviously ongoing. So there was a shift in emphasis to becoming person-centered, and again, as I said earlier, a non-medical, more towards a social approach to the types of interventions developed. This is part of a significant transition program within the Health Service Executive. However, there was a perception that this lacked resources to be fully implemented. There was an emphasis on how to continue to change culture, how to tailor to individuals' desired outcomes, rather than what the service had traditionally been offering, and to upskill staff to meet individual needs and outcomes. And finally, there was a whole emphasis on the need for strong leadership and vision within the services, and this was viewed very much as a prerequisite for success in developing these lifelong learning opportunities. It was very evident from even that very, small scale in a way, stakeholder consultation, that there was a wide variety of practice in terms of the nature, extent, and scale of provision. So in small centres, there was evidence that small numbers of service users were being supported, and there was a strong emphasis on individuals' person-centred plans and planning. In larger centres, there was a perception that there was less scope to be individualised due to staff to service user ratio, and less linked the provision to individual plans. There were a number of good practice examples provided by stakeholders, and they talked about individuals being supported through learning and development to achieve their goals. But what became evident was that any size a day centre which is responsible to individual plans and delivering activities was much more successful and seen as much more responsive to individual needs. Now, in terms of the service users, the information on the scale and profile of who the service users are was limited, and we identified that in the desk research, and we'll talk a little bit later about the survey, which we are hoping will help us to confirm this type of what the scale and profile for service users is. The profile, as far as we are aware, is very wide-ranging. There are a wide variety of needs, ambitions, and capacity within the services. So there's people with intellectual disability, people with physical and sensory difficulties, and also quite a spectrum from mild to profound disabilities. There are significant differences between younger and older service users. So younger service users entering the service from the education system, there are perhaps expectations of higher levels of support, which they experienced in school, and there was a perception that this wasn't always available to the same extent within the day services. There was also evidence that there appeared to be a lack of preparedness and guidance and transition planning that for these young people as they were leaving school. And there was a question around guidance counselling, and I think this links into this whole area. Families themselves may be risk averse to looking at activities in the community, training, employment, and of course there are issues around the whole welfare system as well in terms of what people are able to do without compromising their benefits. For older people with disabilities who were in the day service for many years, it appears that there was a perception they were accustomed to medicalised model of support, and the primary focus for families was to keep these older service users healthy and safe. And some services indicate the need for training for this group of older users, though this training needed to be age and gender appropriate. Now, we were looking at the definition of what education for adults with disabilities would look like. It was very evident from the consultation that a lot of learning does go on, and service users are supported to develop new skills. But however, learning and education is not a widely used term in the sector, and we just need to be very aware of that in terms of our work there. It's likely to involve a spectrum of education and learning support which promotes skills development, including daily living, and these would be activities of daily living like cooking, basic literacy, numeracy skills, the development of wider skills such as confidence, self-esteem and networking, and support to access mainstream provision. So this could be tertiary level courses via universities, institutes of technology, and also further education courses. There appeared to be a silo approach across health and education and day services. Typically, health stakeholders don't regard education as part of their remit, and education stakeholders may not regard day services as part of their remit. And I think this is the transition, part of the whole transition and the move from a more clinical medical model to a social model. Some stakeholders felt that day service should provide access to mainstream education, and they encourage mainstream where possible to promote inclusion within their local communities. Now, the second part of what, or third part of what we're doing is a survey of day service locations. And this has already been distributed electronically across adult day service locations throughout Ireland. And the purpose of the survey is to develop an understanding of the sector. Again, given our lack of knowledge and in-depth knowledge at times of what is happening throughout the sector, this is absolutely vital. So this is looking at a profile and the characteristics of adult day service locations, a profile of staff, including training opportunities, continuing professional development, a profile of the lifelong learners, and then the range and scope of opportunities for learning available in adult day services, and the types of learning support provided within the day service location, how this learning is delivered, and then the outcomes that adults with disabilities achieve as a result of the learning. And we're hoping that these survey findings then will help us to develop a profile of the sector regarding learning provision. And any of you who have received this survey and have yet to contribute, we hope to encourage you that you would help us with this. The critical area as well that we're going to be really involved in is the whole area of site visits of adult day service locations. And so we'll be visiting 20 to 25 adult day service locations throughout the country with a whole range of different types of services, as much as we can manage within that number. And this will involve qualitative interviews with members of staff and service users to develop an understanding of their experiences and how learning support has been delivered. It'll also involve observations to provide holistic understanding of the setting, how supports are delivered, including staff practice, environment, resources, and levels of engagement. So that is where we are in terms of the research. We're obviously at a reasonably early stage, and any support or help anyone can give, we would be very delighted with that. So we'll finish there.
Thank you.
Thank you.